Bismillahirrahmanirrahim. Today, our topic of discussion is angina, and today's topic is the continuation of the previous topic of coronary artery diseases. Angina. What is angina? First question arises: what is angina? Angina is a type of chest pain caused by reduced blood flow to the heart. Reduced blood flow to the heart means that it is one of the coronary artery diseases in which the coronary simply it means that the coronary artery is blocked. Chest pain of cardiac origin symptoms. It means that chest pain is not just present in angina. It is the common symptoms in many diseases like chest pain is present in when there is problem in respiratory system. So the differential feature clinical feature of chest pain in angina are the chest pain in angina is central and diffuse. It is gradual in onset and takes several minutes to develop. It is dull, constricting in character. It may radiate to neck, jaw, and arm. It occurs during exertion, during emotions, and in cold wind. Management of angina, lifestyle modification, smoking cessation, weight reduction, regular exercise, control blood pressure, diet, reduce intake of saturated fat and cholesterol. As angina is one of the coronary artery diseases, and the most common symptom of coronary artery diseases is atherosclerosis. And atherosclerosis is caused by saturated fat and cholesterol. So, in management of angina or for lifestyle modification, we must reduce intake of saturated fat and cholesterol. Treat hyperlipidemia. Again, the same reason. Treatment of angina. In angina, there is inadequate oxygen delivery to the heart, so it can be corrected by two ways: increasing oxygen delivery to the heart or decreasing oxygen requirement of the heart. Nitrates, calcium channel blockers, and beta blockers reduce oxygen requirement of the heart. Nitrates, calcium channel blockers can also increase oxygen delivery by reducing spasm. Therapeutic drugs. Drugs used in coronary artery diseases are nitrates, calcium channel blockers, and beta blockers. Nitrates. Nitrates releases nitric oxide. What? It releases nitric oxide, and nitric oxide is released through the action or by the action of the mitochondrial enzyme aldehyde dehydrogenase 2, and this nitric oxide causes the increase of second messenger CGMP, cyclic guanosine monophosphate, and this causes relaxation of smooth muscle. Muscle relaxation causes venodilation, as veins are reservoirs of blood. So, veins, when constrict, they increases venous return to the heart. But when veins are dilated, blood pools up or dams in the veins. So, when venous return is reduced, ultimately cardiac output will be reduced. It is simple, very simple, and very logical. Let's say, for example, if 70 ml of blood comes to the heart, so it will pump 70 ml of blood or reduced or below 70 ml. It cannot pump 80 ml of blood when 70 ml of blood is coming to the heart. It is so simple. So when cardiac output is reduced, it will reduce work output of the heart, so it will reduce oxygen uh, requirement of the heart. A smooth muscle relaxation causes venodilation, but it also causes relaxation of arterial smooth muscle. And when arterial or aortic smooth muscle is relaxed, it decreases aortic pressure. So it will reduce afterload, and afterload is simply the resistance against which left ventricle is pumping the blood. So if the resistance is reduced, ultimately it will reduce the cardiac out ultimately it will reduce the oxygen requirement of the heart by decreasing the work output of the left ventricle or heart. Example of nitrates are is isosorbide dinitrate, calcium channel blockers. Calcium channel blockers, as its name indicates, it blocks calcium channels, especially L-type calcium channels. So it reduces intracellular calcium level. It is obvious that when calcium channels are blocked, so no more calcium is going inside the cell, so there will be reduced calcium level inside the cell. It will relax blood vessels. As if it is smooth muscle, cardiac muscle, or skeletal muscle. In all these three muscles, contraction of muscle is caused mainly by calcium. It binds with troponin and then it initiates contraction of the muscle. So it relaxes blood vessels, and it also decreases rate of the heart and contractility of the heart. Example of calcium channel blockers are verapamil and diltiazem. Beta blockers. Beta receptors are present in the heart, blood vessels, and in on airways, smooth muscles of the airways. Beta 1 receptors are present on the heart, and beta 2 receptors are present on the smooth muscle of the airways. When beta 1 receptors are activated, it increases heart rate, and beta 2 receptors are when activated, it causes bronchodilation or relaxation of airway smooth muscles. Beta blockers block the beta receptors on the heart and blood vessels. So vasodilation of vessels, which reduces venous return and reduces cardiac output, because when venous return is reduced, cardiac output will be reduced. So when cardiac output is reduced, cardiac work will be reduced and less oxygen will be required to the heart. Other drugs used in angina are ranolazine appears to act mainly by reducing a late prolonged sodium currents in myocardial cell by blocking sodium channels in the cell. The decrease in intracellular sodium causes an increase in calcium expulsion through the sodium calcium transporter. Here it is explained: sodium comes inside the cell and calcium is transported outside the cell. So when sodium is reduced inside the cell, it will come inside the cell and more sodium will enter the cell. And when more sodium enters the cell, more calcium will be transported outside the cell. This will reduce the contractility of the heart, which will reduce the work output of the heart and which will decrease the oxygen requirement of the heart. Non-pharmacological therapy of angina are CABG, coronary artery bypass grafting, and angioplasty. Thank you so much.